All right, welcome back to Dr. Moses channel. And on today's video, we want to talk about the top 5 signs that you are having a real medication allergy and not a side effect. In fact, most people are not able to differentiate between allergic reaction and a side effect. And that is why we want to dive into the top 5 signs that you're having a real medication allergy and what you need to do if you notice this. The first top sign is developing a rash or a hive that appears very suddenly. Okay, now a true allergy reaction often shows up very suddenly. You can develop a red itchy bump or a raised patch. We call that hives, and this may start on your arm, your chest, your face, and they spread very quickly. And they are most of the time they are very symmetrical. Okay, now so you can notice them on both arms, or they are very symmetrical part of your body. You can notice these kind of rashes after taking the medication. They develop very suddenly. For example, amoxicillin, penicillin, you took them, and all of a sudden you develop a red itchy rash within a few hours, sometimes days. These are warning signs that you're having an allergic reaction to the medication. And the first thing you want to do is to stop the medication immediately and then report to your physician or go to the nearest healthcare place so that they can give you medication to counteract the reaction. So it's very important. The first thing you want to do is stop the medication immediately if you develop a rash, a hive after taking medication, especially antibiotics. The second sign that you are having an allergic reaction is the development of a swelling of your face, your lips, and your tongue. This is what we call angioedema. This can be very dangerous. In fact, when you notice a swelling around your eyes, your lips, your tongue, your throat is swelling, you feel a sudden tightness in your chest, or you feel that your tongues are so large in your mouth, this is a sign we call angioedema. They are very dangerous and they can block your airway very quickly. So you want to rush to the ER immediately. In fact, this is different from a sensation of bloating or fluid retention. So this is 911 because you can block your airways and you can die. So, and we see this with medications like lisinopril, ACE inhibitors, or with seafood. You can develop this kind of angioedema to these medications. And in fact, I've seen people who have been on lisinopril for almost like a year or two. They did not have any reaction, and all of a sudden they woke up in the morning, developed the swelling of the tongue. Their tongue just filled their mouth, don't know what to do. That is an angioedema to the ACE inhibitors, and you need to go to the ER immediately. The third sign that you are having an allergic reaction is difficulty breathing and wheezing. Now, any trouble breathing, coughing, wheezing after taking any medication could mean you are developing anaphylaxis. It's a severe allergic reaction, and because it's a severe allergic reaction, sometimes you may feel like you have a tightening of your chest or your throat is tightening, and you should call ER immediately. In fact, if you have epinephrine auto injector, you must inject yourself with it. But if you don't have one, call the ambulance 911 immediately. Don't even wait at all. The fourth sign that you are having an allergic reaction is a severe drop in your blood pressure, or you feel dizzy. In fact, most people will tell you that they are feeling lightheaded, feeling weak, as if they're going to pass out, like they're going to faint. That is a sign that you may be developing anaphylaxis to a medication. And so when you start feeling that sensation, you're going to pass out, the first thing you want to do is to lie down flat, raise your leg, and call 911 immediately. Okay. The fifth sign that this is an allergic reaction is a rapid developing of the symptoms. Anytime an allergic reaction occurs, there is a rapid developing of the symptoms. For example, you took penicillin and all of a sudden you develop a rash, or you took a sulfa drug, or painkillers, or even IV contrast to have like CT scans, you develop an immediate reaction that I mentioned above that is a sign that this is not a side effect, but you're developing what allergic reaction to the medication. What you need to do if you suspect that you are having allergic to medication? Well, report it to your physician so it can be updated in your medical chart, and also get tested by an allergist to confirm it, to make sure it's not a side effect. And then 3, wear a medical alert bracelet if you have a severe reaction, so people know that you have that on your arms and did not administer that medication to you again. So let's recap. What are some of the signs that you have an allergic reaction? Rash or hives, swelling of your face, of your tongue, tightness in the chest, trouble breathing, drop in blood pressure, rapid onset of symptoms after taking the medication. Now, if you experience any of these things before, make sure that you call 911. Now, I want you to subscribe to our video, our channel, like this video if this has been very helpful to you, and share the video with others so they can be aware of some of the signs of allergic reaction. After all, this day we all take medications, and knowing the signs will help save somebody's life. Until then, Dr. Moses will see you on the next episode.